Okay, we are live.
Okay, thank you very much. Good afternoon. I would like to welcome all members, staff, and guests to the September 27th, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting. I would like to remind everyone that our meetings are web streamed and televised, and I apologize for the late start. With that, I call the September the 27th, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting to order. And I'd like to introduce committee member Councillor Patrick O'Neill. He's coming from Haldeman County. So welcome Councillor O'Neill to our Health and Social Services Advisory Committee. And I'll turn this over to Stephanie. She has an announcement.
Thank you, Chair Bentley. I'm happy to introduce our new General Manager of Health and Social Services, who is joining us virtually today. Sarah Page will officially start in the role next week, so warm welcome to Sarah Page, our new GM.
Thank you. Are there any disclosures of pecuniary interest? Oh, Sarah, would you like to speak? I'm sorry. Welcome, Sarah.
No, I was going to just say good afternoon and thanks for having me. Excited to be a part of the team.
Awesome, thank you. Sorry about that. Are there any disclosures of pecuniary interest? Seeing none. Are there any additions to the agenda? None. Presentations and deputations, there are none. Adoption of advisory committee meeting minutes. Health 5.1 Health and Social Services Advisory Committee, July 24th, 2023. May I have a motion to approve the Haldeman Norfolk Health and Social Service Advisory meeting minutes from July 24th, 2023? Can I have a mover for that, please? Sorry. Oh, there you are. Thank you, Councillor Metcalf. Seconded. Oh, thank you, Councillor. Sorry, it's hard to see on the screen. All in favor? All in favor? Carried. Thank you. Update on reports. Are there any updates on previous reports?
Through the Chair, all reports that were brought forward to the Board of Health have been approved. There were no reports brought forward to CIC or Council from last advisory for social services and housing.
Thank you. Are there any consent items? None. Staff reports, 8.1 Public Health, 8.1.1 Acting Medical Officer of Health, Dr. Joyce Locke. Update H&SS 23057.
Thank you, Madam Chair, through you. So my report is for information only. I attempted to highlight a few of the activities that have gone on over the summer that might be of interest to the members attending. Two of them are advocacy issues. We wrote a letter of support for a movement by the Alliance for Tobacco-Free Ontario to encourage an additional tax on vape products to discourage uptake, particularly by young adolescents. We also wrote a letter of support of a bill that's going through the Senate right now, Bill S-254, an act to amend the Food and Drugs Act. Am I echoing? I'm okay. And that letter is attached. I shared with the members here that the Public Health Agency of Canada has released a new toolkit for public health to assist us in preparedness and to response and recovery for wildfires, since that's been quite a significant issue this year, and it has been shared with our environmental health team, who will be working with our local stakeholders to ensure that we are prepared in the event that this happens here. Our fall vaccine program is up and running. The key thing is that The Moderna XBB vaccine has been approved by Health Canada. That's for the new COVID variant. We expect to get shipment of that in early October, and we will be encouraging the citizens to obtain both vaccines simultaneously if it's been at least 6 months since their previous injection or their last infection, as they get their vaccines this fall. There's been a lot of work with our Ontario Health System partners to ensure that we are all, as a collective system, prepared for an increase in cases for the fall and winter respiratory virus season. And the health unit played a significant role in leading the local regional tabletop exercise, which involved Hamilton, Niagara, Brant, us, and other local health units. There will be a change in the rapid antigen test availability this fall, and we're trying to get this message out to all our stakeholders in the community. There will not be availability of RAT tests at usual routine retail outlets such as grocery stores where we found them last year. There will be more limited supply, there will be a communication campaign going out to ensure that individuals know where they can get their tests and how. And I'm encouraging people to, from the advisory committee, to consider attending the local public health agencies meeting this November 22 and 23. It will be held virtually, and as always, it's very interesting. The information and agenda regarding the meeting are attached to this report at the end, where you can find it under Alpha's news update. There's also a public health leadership table chronic disease prevention working group. This is steered by the Chief Medical Officer of Health of the province, and it involves local Public Health Ontario and the Council of Medical Officers of Health. Addressing chronic disease involves addressing the issues along the lifespan, starting early in life and addressing the multiple social determinants of health. And therefore, it is a very complex and long-term type of approach that's required. And by engaging the collective strength of all of public health across Ontario, we hope to make some dents in moving this challenging issue forward. And that's it from my end.
Thank you, Dr. Russo. Appreciate your report. Can I have a motion to receive the H&SS 2307 Acting Medical Officer of Health, Dr. Joyce Locke's update as information? Can I get a mover, please?
Councillor O'Neill's got his hand up.
Oh, thank you, Councillor O'Neill, and I have a seconder here with Councillor Mitchell. Can I get an all in favor, please? All in favor of this? Thank you very much. It looks like it's carried to me. 8.1.2, Alderman Norfolk Health Unit COVID-19 After Action Plan, H&SS 23048. May I have a motion to receive the H&SS 23048 Alderman Norfolk Health Unit COVID-19 After Action Plan as information? May I have a mover, please?
Chair Bentley, we will have to, the staff would like to present this report.
Oh, sure. Sorry about that.
Thank you. Through you, Madam Chair, I would like to introduce my colleagues, Mr. Titmus, Program Manager for COVID Response, Ms. Julie Richardson, Health Planner, and Ms. Nicole Stone, Emergency Planner, to present this report. Thank you.
Thank you.
All right, good afternoon, everybody. As Syed mentioned, I'm Sarah Timmis. I'm the program manager for the COVID-19 response team, and I have my colleagues Nicole and Jimmy with me today, and we will be presenting to you report HS 23048 after action report for information only. Next slide, please. So what is an after action report? Well, it's a process that is best practice after an emergency to review your operations during an emergency, in this case, COVID-19. And we do that in order to document what actions took place, assess challenges and best practices, and make recommendations for improving future emergency responses. This project took place with the help of an internal steering committee and an external engagement agency, and the end goal was to identify improvements in emergency policies and procedures for the health unit. The time period for the project was January 2020 to June 2022, and I will now hand over to Julie and Nicole to provide highlights of the project today.
Thank you, Sarah. Yes, as Sarah just said, one of the purposes of a COVID-19 after action review is documenting our response. So I'm going to spend a few minutes just talking about that. The summary report that's included in your package has an abridged timeline of our COVID-19 response, and a more detailed timeline and narrative of the health unit's response were also documented as part of this review. And today we just want to share with you some highlights of this time. So this graph that I have up on the screen and is in your report helps to depict the incredible amount of work that was accomplished during the time period of March 2020, when the health unit had its first confirmed case of COVID-19, and June 2022, which is, even though that's not when the pandemic ended for this review, that was the timeline within scope. As from the health unit's perspective, that's when we put most of our COVID-19 response back to just our COVID-19 team and our COVID-19 vaccine team. So the green bars are the number of confirmed cases in the hundreds, and the yellow line is the number of confirmed outbreaks. So you can see the waves of cases throughout the pandemic and the outbreaks that follow a similar pattern. In early 2020, the case and outbreak numbers are relatively low compared to what we saw later in the pandemic, but early case and outbreak management for a new disease included setting up procedures for case and contact management, organizing testing, following up with any suspected cases, and public communication. We also managed 2 large outbreaks during this time before formal guidance from the province on best practices for outbreak management had been published. Each successive wave saw more cases and more outbreaks, and the health unit continually adjusted its response based on the needs of our community, the direction from the province, and implementing efficiencies to improve our response. You can see the peak of cases was around December 2021 and January 2022, which is when the Omicron variant arrived. And as I'm sure you either remember or would understand, this was incredibly busy times for the health unit. And then coming towards the end of the graph, in March 2022 is when the provincial government released its Living with and Managing COVID-19 plan, which signaled our move to recovery from the COVID-19 pandemic response. And then also overlaid on this graph is, in the blue line, is the number of COVID-19 vaccine doses that were administered each month by the health unit and by community partners. That's the axis on the far left in blue. The numbers are in the thousands. So starting in December 2020, there was a significant effort mobilized in order to coordinate and vaccinate those most at risk, followed by adults and the general public, and later children and youth. And at the peak in June of 2021, the mass immunization clinic in Cayuga was vaccinating over 1,200 people a day, and over 40,000 doses were administered in that month. Also, just briefly highlight some of the quantitative statistics from our COVID response, again from that same time period. So during this time, we had 8,863 confirmed cases of COVID-19 that were reported and managed by health unit staff, plus many more contacts and persons under investigation that we helped to support. And of these cases, there were 82 fatalities where COVID-19 was the reported cause of death. We had 272 confirmed outbreaks that were declared in settings such as hospitals, long-term care homes, retirement homes, congregate settings, schools, and recreation centers. But this number does not include all of the suspect outbreaks that the health unit also supported. For this time period, over 221,000 COVID-19 vaccine doses were administered by the health unit and its partners, 94 unique vaccine clinics across both of our communities, and as well as 31 locations where the GoVax bus offered clinics. And this high number of vaccine clinic locations speaks to the health unit strategy to be adaptable as vaccine demand ebbed and flowed, and to try to reach as many people as possible in their communities. During this time, the health unit responded to more than 66,500 calls to support the public with things from booking vaccine appointments or testing appointments, enforcing the COVID-19 measures, and addressing questions related to COVID-19 infections and exposures. We had over 80 media briefings that were held to keep media and the public informed of the status in our community. And all of this work was accomplished by the dedicated and passionate teams here at the health unit and Norfolk County staff who were redeployed to support our response. And at the peak, over 150 staff were part of this team. So I want to mention and acknowledge that the health unit's response was strengthened by the support and the leadership of many partners and stakeholders in our community, both community members as well as Norfolk County pieces. So I'm now going to pass it over to Nicole to walk you through the methods and final recommendations of this review.
Okay, thank you. So I'm going to share with you briefly the methods we took to generate this report. So the project, while voluntary, provided opportunities for all health unit team members to participate and provide feedback. Before any data collection occurred, we also received approval from Public Health Ontario's Ethics Review Board. So this project was a multi-phased and iterative data collection and interpretation process, with each phase informing the next. The first phase of data collection included a review of emergency documents, and this document review was completed to help generate a response timeline, to identify emerging themes or pain points, and to inform the development of data collection tools like our survey and key informant interview guide. Following this, an online survey was sent to all health unit team members, as well as individuals who were redeployed to the response from other county departments. Key informant interviews were then completed by an external engagement agency with members of the health unit's leadership team. And then finally, key themes generated from both the survey and key informant interviews were explored through a facilitated workshop, which identified root causes as well as assessed and prioritized corrective actions or improvement ideas for future emergencies. And throughout this entire process, 5 key recommendations have been proposed. So these are the 5 recommendations that I will go over now. So due to the unprecedented response to the pandemic, emergency plans, training, and tools were not able to sufficiently prepare the health unit to respond to a public health emergency of this magnitude and duration. Therefore, the first 2 recommendations are around training and review and update of emergency plans. The first recommendation is to develop and implement a comprehensive emergency preparedness training plan for the health unit, which includes specific and regular training requirements outlined in an emergency preparedness policy for all team members. The second recommendation calls for review and update of all emergency and business continuity plans, which incorporates lessons learned from the COVID-19 response. And these reviews will focus on ensuring that these plans are practical and easy to understand, while also providing sufficient detail to guide the health unit in future emergency responses. The third recommendation is around exploring opportunities to support staff redeployments, flexible hiring, and upstaffing when the health unit activates its emergency plan. So a common challenge that we heard in the review was around heavy and persistent workload. An emergency response of this size requires individuals to transition to new and unfamiliar roles and may require the quick hiring of additional staff to support the health unit in balancing the competing pressures of emergency response and maintaining core public health programs and services. The fourth recommendation is around coordination. A municipal emergency operations center, or an EOC, is a facility where key municipal personnel and other agencies gather to support the activities taking place at the site or sites of an emergency while facilitating a coordinated response. And during COVID-19, the municipal EOCs provided functions that were critical to the health unit's response. Therefore, this recommendation calls for the health unit to continue to build strong partnerships with Haldimand and Norfolk counties and establish joint plans on how the health unit works together with municipal EOCs during public health emergencies. Finally, the last recommendation is around technology. The pandemic response forced the health unit, like many organizations, to alter and adapt standard operations, resulting in innovations that can be leveraged beyond the pandemic response. Investing in technology software that would enhance the health unit's ability to respond to future emergencies, but will also be valuable in program delivery and operations during non-emergency times, will strengthen the organization's preparedness and ability to maintain business continuity. In addition to these 5 recommendations, 10 lessons learned are also highlighted within the report, and these range from ensuring policies, procedures, and resources are put in place early to prioritize responder safety, providing regular debrief opportunities, to providing strong risk communications and leveraging partnerships to support public health efforts during an emergency. Together, these recommendations and lessons learned have informed the development of an improvement action plan, and this plan is going to guide staff in operationalizing these recommendations and ensuring that the health unit is better prepared for future public health emergencies. So that concludes the presentation, so thank you, and I will open it up for questions.
Thank you. Are there any questions? Any questions, comments? None? Well, I want to thank Julie, Jacqueline, and Nicole for this presentation. I really appreciate all the hard work that you folks have done, all the hard work that the health unit has done over the last couple of years with COVID, going into a pandemic like that without having the supports in place, and just picking up and making sure all of Haldimand Norfolk was kept safe during that time is extraordinary. So thank you for all your efforts and your presentation today. With that, may I have a motion to receive the H&SS 23048 Haldimand Norfolk Health Unit COVID-19 After Action Plan as information? And mover, please. Thank you, Councillor. Seconder. Councillor Metcalf, all in favor? Thank you, it's carried, as far as I can see. Thanks, ladies. We'll move on to 8.1.3, Haldimand Norfolk Health Unit Strategic Planning Process, H&SS 23050.
This report. Thank you, Madam Chair. I'll be presenting this report. So, Health Unit is currently conducting a strategic planning process in order to develop a new 5-year strategic plan. As per Ontario Public Health Standards, all boards of health must have a strategic plan for 3 to 5 years. Our last strategic plan was expired in 2020. That was for a period of 2016 to 2020. As we are all aware, the pandemic started in March 2020. But in the spring of 2022, as we move towards the recovery phase of the pandemic response, an interim strategic plan was developed that carried us for next 12 to 18 months. Now we have contracted an external agency to facilitate the strategic priority setting process. It will be a consultative process where members of this forum, as well as Board of Health, they will be invited for focus group discussions, one-on-one interviews, and a planning retreat in fall. The plan is that we are going to have this strategic plan by early 2020, 4 for your final approval, and it will be launched in the first quarter of 2024. With this, I have only one recommendation because, as I mentioned, it will be a consultative process. So my recommendation would be that clerks of both counties in Haldimand and Norfolk, they work together and come up with a schedule for focus group discussions, and our planning will be in fall. Thank you, and I'm happy to answer your questions.
Thank you, Saeed. Is there any discussion? No discussion on this? Yeah, sorry? May I have a motion to receive HSS 23050 Haldeman Norfolk Health Unit strategic planning process as information? May I have a mover, please? Thank you, Councillor Metcalf. Can I get a seconder, please? Thank you, Councillor Van Passen. I think that's who it is. It's hard to see. I'm sorry. I think I need a bigger screen. Thank you very much, Councillor Van Passen. All in favor? All in favor. Thank you. Motion is carried. Thank you. Carry on to 8.1.4 Health Unit Equity Plan, HSS 23049.
Thank you, Madam Chair. To you, I would like to introduce my colleague, Ms. Jackie Dover, to present this report. And then we have Marciana Montodo, who is the program manager for this program, and myself. We are here to answer any of your questions. Thank you.
Thank you. Through the chair to the committee, my name again is Jackie Dover, and I'm a public health nurse. And I will present the Health Equity Program Memo, HS 23049, to be received as information. And so, but before I provide this brief update, it might be helpful just to review briefly what we're talking about when we talk about health and health equity. And the World Health Organization gave a lovely definition of health, defined as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So this is more than just the absence of disease. And health equity is really achieved when everyone can reach their full potential for health and well-being. And so in August of this year, we refreshed our Haldeman and Norfolk Health Unit Health Equity Program. And this memo just really highlights the goal, the pillars, and the activities. And this is really, just want to say, really an ideal time to refresh this program, the Health Equity Program, given the real interest right now, the current interest in strengthening public health at all levels, local, regional, and provincial. And so over the next year, our Health Equity Program are really focused on the capacity of our workforce, so really strengthening that capacity to advance health equity, and with the aim to really ensure that no one in our community, so no one in Haldeman and Norfolk, is left behind, especially those folks, those members of our communities who are the most vulnerable to poor health outcomes. And so the program will cover the following three priority areas: organizational capacity building, community engagement, and interprofessional and intersectoral collaboration. And I'll provide highlights of each of these program areas. So for organizational capacity building, this really involves training and skill development for our public health workforce to really support the integration of what we're calling a health equity lens or framework into all of our programs and services. With community engagement, we are already working with community, but we are looking at strengthening those connections and relationships with our community members and our community partners. And finally, in terms of intersectoral and interprofessional collaboration, again, this is a strengthening of our existing collaborations and partnerships, and this is internally, so across our teams and across roles and disciplines, but also externally across all sectors as well. So beyond health, housing, human services as well. And in conclusion, over the next year, we're going to continue to build on lessons learned and the work that we've already been doing. And we really welcome your thoughts, questions, and inputs along the way, along this journey. So thank you. That's my update. And welcome any questions.
Thank you, Jackie. Are there any questions for Jackie? Nat, I appreciate your report today. Thank you very much for taking the time out of your day for this. Thank you.
Thank you, Madam Chair.
May I have a motion to receive the HSS 23049 Health Unit Equity Plan as information? Can I get a mover, please? Thank you, Councillor Van Passen. Can I get a seconder, please? Councillor Metcalf, thank you. All in favor? Carried, thank you. The next one is 8.1.5, strengthening public health and voluntary merger, HSS 23056.
Thank you, Madam Chair. I'll be presenting this report. So on August 22nd, Health Unit receives a communication from Chief Medical Officer of Health highlighting the new strengthening public health strategy. So there were 3 pillars to this strategy. The first one was clarifying roles and responsibilities of the Health Unit. What does it mean is that Ministry will be conducting a sector-driven review of Ontario public health standards so that to clarify the roles and responsibilities of the public health units. The second pillar was supporting voluntary mergers. So the Health Ministry is asking the health units to look for opportunities so that they can voluntarily merge with the other health units. They make it clear that this is not a cost-saving exercise, but this exercise would be to have more efficiencies in terms of public health services. And the third strategy was to provide sustainable funding for the merger. So there will be a merger support fund that will help all the health units who are going to voluntarily merge to support them through that process. And that fund would be available for the next 3 years. There is an appendix attached to your report which mentions the timelines. So in terms of timelines, we have to submit a report about the merger with our annual service plan deadline, that's March 1st, 2024. And the whole implementation of the merger will start January 1st, 2025. So there are 2 recommendations in this report. The first recommendation, because of the timelines, is that Board of Health and this forum authorize Director of Public Health to engage with Norfolk County purchasing team to explore expedited procurement process to hire a consultant for this project. And in terms of the other timelines about reporting, so we are planning to come back to this forum and to Board of Health in February 2024 so that we can submit a formal report to Ministry of Health in 2024, March 2024. The other recommendation is that we are advising Board of Health and Advisory Committee that to hire a consultant who will be looking and reviewing the pros and cons of voluntary mergers for Haldimand and Norfolk Health Unit. So that will help facilitate decision making by this forum and Board of Health. With this, I'm happy to answer your questions. Thank you.
Thank you very much. Are there any questions, comments? Zena, may I have a motion to receive the HSS 23056 strengthening public health and voluntary merger as information, and that the Director of Public Health engage with Norfolk County purchasing team to explore expedited procurement options such as a vendor of record, to secure a consultant to explore merger options with neighboring health units, and present a report with recommendations. And further that, the consultant's report and an accompanying staff report be brought back to the February Board of Health meeting for decision on a potential voluntary merger to be included in the 2024 Haldimand Norfolk Health Unit Annual Service Plan. May I have a mover, please? Thank you, Councillor O'Neill. Seconded. Thank you, Councillor Van Passen. All in favor? Carried. Thank you. 8.2 Social Services and Housing. 8.21 Service Manager Consent. Sale of HNHC Properties, HSS 23-047.
Thank you, Madam Chair. Through you, I will be presenting this report this afternoon. I wanted to note that there is a typo on the report that I will correct for CIC. I have the incorrect date for CIC as October 10th. It is October 11th. This report is seeking direction from Council to provide service manager consent from the Consolidated Service Manager to Halton and Norfolk Housing Corporation to sell 2 identified properties in the regeneration master plan that were identified as leverage. These 2 properties are 7274 Oakwood Avenue in Simcoe and 643 Gibraltar Street in Delhi. Through conversations with the CEO of Halton and Norfolk Housing Corporation and through recognition that the master plan was approved by Council in July 2021, Service Manager is prepared to provide this level of support and sees all necessary guidelines in the Housing Services Act as having been met by the Housing Corporation in order to move ahead. The funds from the sale of these properties would be reinvested in repair and building of new affordable properties in our community, which would be very needed and very necessary. I know that everyone is highly aware of the need for affordable housing, and so this begins that process of moving ahead. There is a note in the report that I just wanted to point out that any further service manager consent related to this regeneration plan would be brought forward to Council for approval. And so this is simply seeking service manager approval for Halton and Norfolk Housing Corporation for these 2 identified properties. And with that, I'll answer any questions.
Thank you, Christina. Are there any questions, comments? We're a quiet group today, I guess. But thank you, Christina, for your report. And look forward to Halton Norfolk Housing Corporation approving. Thank you very much.
Chair Bentley, that report was given to you from Stephanie, not Christina.
Oh, I'm sorry.
That's okay.
Sorry, Stephanie.
That's okay. No worries.
Sorry about that. It says Christina right on my screen. I guess Christina must have logged in. This Zooming I do not like. I like in person much better.
It's easier, isn't it?
I can see your faces and I have my readers on. So I do apologize for that.
No worries at all. Thank you.
Could I get a mover, please, for this report? Thank you, Councillor Van Passen. Can I get a seconder, please? Thank you, Councillor Metcalf. All in favor? Carried. Thank you. 8.2.2 Provincial Allocation of Ontario Priorities Housing Initiative, OPHI, and Canada Ontario Community Housing Initiative. Funding and Investment Plan 2023 to 2024 Budget Amendment. HSS-23-05.
Thank you. Through the chair, I would like to introduce the Program Manager of Housing Services, Jessica Horton. I'd like to thank Jessica for the work that she's done on this report. We have a rather tight turnaround on this one due to the ministry announcement. So thank you again, Jessica, for that hard work. And if you'd like to go ahead and present the report, that would be great. Thank you.
Thank you. Through the chair to committee. This is about the Canada-Ontario Housing Initiative, which I will refer to as COCHI, and the Ontario Priorities Housing Initiative, which I will refer to as OFI. For members of committee, this funding is our current funding pot for affordable housing. It has been called various different things over the years, with the current funding pot being COCHI OFI. The purpose of COCHI funding is to maintain our stock of community housing and to allow our 11 housing providers, including Halton and Norfolk Housing Corporation, to access this funding for capital repairs. We have allocated this funding to each of the providers based on
on a percentage. For example, if you own 10% of the housing stock in Haldeman Norfolk, then you would receive 10% of this funding for capital repairs. The OFI funding has different program streams. I will provide a brief overview of the program streams that funding has been allocated for this year. The home ownership program, which is to assist low to moderate income renter households. Not the home ownership program, the Ontario Renovates program, which is to assist low to moderate income renter households to do renovations on their homes that would allow them to continue residing in those homes. And then there's also the home ownership program, which is to assist low to moderate income renter households, as well as first-time home buyers purchase an affordable home by providing down payment assistance. The rental assistance component is for rental supplements and housing allowances, which addresses affordability issues for renter households, and housing support services, which is to provide support services to tenants living in social or affordable housing to achieve housing stability. And with that said, I will turn it over for any questions. Thanks.
Thank you. Thank you for your report, Jessica. Is there any questions or comments? No, we appreciate the report, Jessica. I have a motion to receive the H&SS 051 provincial allocation of Ontario Priorities Housing Initiative, OPI, and Canada Ontario Community Housing Initiative, COCHI, funding and investment plan 2023 to 2024 budget amendment. Got the staff report H&SS 23051 provincial allocation of OPI and COCHI funding and investment plan 2023 to 2024 budget amendment be received as information. And that council accept the COCHI funding in the amount of $507,600 and that OPI funding in the amount of $505,400. And that council authorized the mayor and clerk to sign the required transfer payment agreement with the Ministry of Municipal Affairs and Housing. And that council approved the per program funding allocations as outlined in this staff report. And further, that COCHI and OPI investment plan containing the per program allocations be submitted to the Ministry of Municipal Affairs and Housing. Can I have a mover, please?
Not enough of us today.
There's not enough of you today. Councillor Metcalf moved it. Can I have a seconder, please? Councillor Van Passen, seconder. Thank you. Can I get a all in favor? Yes, see Patrick. This motion is carried. Thank you. Thanks, Jessica. 8.2.3 Homelessness Prevention Program Update. H&SS 23-054.
Thank you. Through the chair, I'm pleased to introduce or reintroduce Louise Lovell, our Program Manager for Homeless Prevention Services. I wanted to thank Louise as well. This was another one that we needed to get together quickly so that we could move forward with much needed services in our community. So Louise, if you could present, thank you.
Thank you. Through the chair to the members of Health and Social Services Advisory, thank you very much for taking the time to hear our update today and consider the recommendations that we're putting forward. This is essentially a housekeeping report today. Sorry, there's an echo for me. I'm not sure if you guys are hearing it. I'm not sure what's causing it. I apologize. We brought to you back in May of this year a report regarding the Homeless Prevention Program Investment Plan. And in that report, we asked you to accept the per program allocations that we had put forward. And you did do that, and that report was approved, and the investment plan was put forward to the Ministry of Municipal Affairs and Housing back in June of this year. In moving forward with the investment plan and the allocations that we had approved, the two of the initiatives included extending contracts for a couple of community organizations that are providing some services for us that we only had a 1-year contract for, because last year in our allocations, that's all we had funding for. So when we asked you to approve the per program allocations, the language was not specific enough in the recommendations to be able to comply with the purchasing policy CS-02 and section 4.8.4. So essentially what we're asking you to do today is just reapprove the allocations that we allocated for the warming center for our partner Church Out Serving, and for the transitional housing program that's being delivered through Indwell. And we are asking that we continue those contracts for a 15-month period for this first approval period in order to align with MMAH's fiscal allocation year. And then we're asking to be able to further those contracts for another 5 periods of 1 year prior to having to go back to RFP. Both of these services were secured through an RFP. There is no competition for either of these. They are not in direct competition with each other. There was no competition for these contracts through the RFP process. We don't anticipate any organizations in the future looking to deliver these services other than these 2 providers. So we are looking to enter into a long-term commitment with them that of course will be renewed as per the purchasing policy in the years to come. So the other thing that we're looking for is the ability to negotiate these contracts, because they're human services that, you know, we're not snow plowing, we're not building roofs that are fairly standard services. We're looking for the ability to negotiate these contracts each year when we update them based on changes to MMAH's guidelines with the HPP program. So each year in these contracts, we include data reporting elements that we then have to report to MMAH and so on and so forth. Those things sometimes change year over year, and we have to be able to update that contract year over year. And we're looking for council to approve us to be able to do that without coming back through the RFP process every year. So with that, I leave it for any questions if any of you have. But again, the report is essentially the recommendation to continue the projects, but with more specific language than we brought in the spring.
Thank you, Louise. That was a great report, and I understand that completely. Absolutely makes sense. So may I have a motion to receive the H&SS 23054 Homelessness Prevention Program update, receive report as information? And I forgot to ask if there was any questions or comments for Louise before I continue. Nope, quiet group today, Louise. Thank you. I'll continue on then. And that council authorized a single source supply as outlined in Norfolk County Purchasing Policy CS-02, section 4.84, to permit the Director of Social Services and Housing and the Program Manager, Homeless Prevention Services, to negotiate with Church Out Serving an amendment to the executed contract for RFP HSS-SSH-22-04 Emergency Shelter Solutions, an option to extend the existing contract based on the updated agreement for a period of 15 months, with the option to further extend the agreement for 5 additional terms of up to 1 year each term. And that council authorized a single source supply as outlined in Norfolk County Purchasing Policy CS-02, section 4.8.4, to permit the Director of Social Service and Housing and the Program Manager, Homeless Prevention Services, to negotiate with Indwell an amendment to the executed contract for RFP HSS-SSH-22-04 Supportive Housing, an option to extend the existing contract based on the updated agreement for a period of 15 months, with the option to further extend the agreement for 5 additional terms of up to 1 year each term. And further, that council authorized a single source supply as outlined in the Norfolk County Purchasing Policy CS-02, section 4.8.4, to permit the Director of Social Services and Housing and the program manager, homeless prevention services, to negotiate new contracts in Norfolk for emergency solutions and transitional housing services should the current providers decline any contract extensions. Can I get a mover, please? It's only you two. Councillor Metcalf, thank you. Can I get a seconder, please? Councillor Van Passen, maybe you would like to second that.
His hand up and you're missing him, so like we better give him credit.
Maybe I need. Still doesn't help me. I expanded my screen, but it still doesn't help me. Okay, all in favor? Carrie, thank you. Under subcommittee reports, there are none. Communications. Saeed and Dr. Locke will talk to these communications, 10.1, 10.2, and 10.3.
Thank you, Madam Chair. So these are communication items from Alpha for the month of July, August, and September for your information only. And 10.4 is the letter of Chief Medical Officer of Health, which I reference in my report.
Madam Chair, you're on mute.
Yep, sorry about that. Sorry, Saeed. Do we just continue on with all the communications and ask questions after? Or we just receive these as information? No? Sorry, my question is, sorry, is Dr. Locke going to speak on these matters too, or we're just going to receive those reports?
I think through you, Madam Chair, they're there for your information. Within one of the information break documents from Alpha is all the information on the upcoming virtual Alpha meeting in November. So I encourage you to look at that.
Yes, thank you very much. Other business, there is none. Closed session, there is none. Next meeting, 13.1 is Monday, October the 23rd at 2023. Can I have a motion to adjourn this meeting at 4:06 p.m.? Can I get a mover, please? Thank you, Councillor Metcalf. Seconded. Is Patrick waving at me? I can't see him. Councillor Van Passen? Maybe
yeah,
I
seconded.
can see you.
I can second.
Thank you. Thank you very much. All in favor? It's carried that this motion is carried. Thank you. Sorry about the meeting today, folks. A little rusty on this Teams. Thank you.